Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erika Mayall. Before we get into today's podcast episode, just a quick reminder to like and subscribe if you have not already to the podcast. And while you're there, if you want to leave a rating or leave a review, that would also be so appreciated. All right, today we are going to talk about common challenges with pointe shoe fitting. And just first of all, off the bat, disclaimer, I am by no means an expert pointe shoe fitter, and you'll see what I mean by that in a minute. So this is not meant to be like specific pointe shoe advice, but I want to get into some of the common challenges that we see with dancers when they are trying to find their sort of quote unquote perfect shoe. And this all came about because a couple weeks ago, I was invited to go and speak at the Dancewear Association of Canada, DAC, D-A-C, the Dancewear Association of Canada annual conference that was in Ontario. It was in Niagara-on-the-Lake, and they wanted to have a presentation or like a kind of workshop-y type presentation on some of the common challenges that we see in pointe shoe fitting, and also why pointe shoe fitting and shoe fitting in general is so important. And when they first reached out to me and said, hey, would you be interested or willing to come and talk at this conference? My initial reaction was like, I'm not a pointe shoe expert. Like I do know a fair amount, and I have my own background in dancing on pointe, and I do pre-pointe assessments and all of that sort of thing. But when it comes to actual like pointe shoes and what's on the market, the products are evolving and innovating so quickly that I am by no means an expert in this area. So my initial reaction was a bit like, I'm not sure if I'm totally qualified to speak on this topic. But as we went back and forth, it became apparent that what they were really interested in is the retailers who were there. So this conference, I guess a little bit of background, this conference is the Dancewear Association hosts a conference where they bring retailers from all the local retail stores across Canada to this conference, and it's a chance for them to interact with the dancewear brands. So all the major brands are there represented, and they see latest product lines and things like that. But they have more recently added on more of an educational component as well. So I was not the only speaker at this event. There were other speakers speaking on other topics that are relevant to retailers, even things like social media and how to enhance your social media presence as a retailer. But they wanted the retailers to have a little bit of background about why what they do as a shoe fitter is so important. And so a little bit more from kind of like the anatomical or like the health and wellness perspective. So once we kind of like hash that out a bit, I was like, oh, okay, this is definitely something I can speak on, because as much as I am not an expert on every pointe shoe on the market, I am an expert on the foot and the mechanics of the foot and how the mechanics of the foot influence movement through the rest of the body and all of those types of things. So it was a very, very, very cool opportunity to speak to and like interact with a facet of the dance community that I don't always have a ton of interaction with. I do have interaction with a few of the local retailers in the Vancouver area, but a lot of my interaction with retailers just comes from myself being a customer when I'm going in to get my ballet shoes or whatever it is, or interactions that I have with dancers I work with, and we're sort of like, passing information back and forth when they are going to get fitted for shoes, I will say, let the fitter know X, Y, Z. And then the fitter will sometimes send information back and say, hey, there's something funky going on with their, foot or whatever it is. So it's not always super direct communication. But presenting at this conference really made me realize that we should have much more direct interaction and direct communication with our retailers. They are truly the experts in fitting the shoes and knowing what shoes are available on the market and, even what's available in Canada versus what's available in the US and things like that. But they often do need more information about the dancer's physical state. Where are they in terms of if it's recovering from an injury, getting back after injury, or what are, some challenges that dancer's having from a physical perspective. They're not experts on that, similarly to me not being experts on the kind of availability of products on the market. So it just really drove home the point of it should be a team effort, and we could probably, or at least I personally, could probably do a better job of communicating directly with the retailers in my area and not necessarily relying on the dancer or the parent to kind of pass information sort of back and forth. So that was one of the really big take homes from the conference. And like I said, it was a really great event to be a part of because it was people and a part of the dance community that I'm not as involved with, but I made some great connections and everyone was so lovely and so welcoming. So I really enjoyed being part of it. But one of the things we talked about, or one of the things I presented on, were some of the common challenges we see in pointe shoe fitting and some of the potential shoe issues, we'll say, that could be causing those problems, and then some of the potential more physical or anatomical issues. Because there's certain challenges that we see commonly in pointe shoe fitting, and sometimes it's the shoe, and sometimes it's the actual dancer and their anatomy or that type of thing. And so we kind of talked about that. And as I was going through that part of the presentation, I was thinking, this would make a really good podcast episode because I know there's a lot of dancers out there or even dance teachers who have dancers who are struggling with certain things, like kind of challenges with their shoes and shoe fitting. And so I thought I would at least pull this part of the presentation out and turn it into a podcast episode. We talked about loads of other stuff as well. This was not like the entire presentation, but I'm not going to go into all of that. One of the things we touched on a lot was the importance of and the rationale behind having a pointe readiness assessment or a pre-pointe assessment done. And I have covered that before on the podcast. And so I think there's actually 2 episodes that cover that topic. So one of them was episode 4, way back in the beginning, that is just called pre-pointe assessments. And then also episode 106, which was called Pointe Readiness Assessments for Dancers. And some of the information is overlap in those episodes, but they are slightly different as well. So I will link both of those in the show notes if you want to go back and are more interested in knowing about how to determine if a dancer is ready to progress to pointe. So that was something we covered. But today, what I want to dive into is these kind of common challenges that we see in terms of kind of pointe shoe fitting some of the time. So I've broken them down into 2 categories. The first one is more kind of like skin and nail health issues that we see. And then the second one is more sort of structural or biomechanical issues. So we're going to start with skin and nail health issues. So number 1, and every dancer is going to be familiar with this, is blisters. And I am not talking about the dancer who maybe has like an extra long rehearsal on pointe and dances way more on pointe one day than they're used to, and they get a blister and it is, a kind of one-off occurrence. That will happen occasionally. That I am not concerned about. I am talking about the dancers who every single time they put their pointe shoes on, they are getting blisters, or sometimes dancers are getting calluses. And I'm going to talk about calluses kind of twice because sometimes if we're getting recurrent blisters enough, we'll actually start to develop calluses or build up calluses in those areas. So both of blisters or this type of calluses are caused by excessive friction happening in the shoe. There is friction that is happening between some part of the shoe, and it is usually on kind of the surface of the toes, and the shoe rubbing. And so it's this excess friction that is happening. So from a shoe perspective, some of the things we want to consider would be that the shoe is potentially too wide. So there's just too much room for the foot to kind of move around in. The shoe might be too high volume. And what that means is kind of like if we think of the front of the shoe, so where the vamp is, it's too tall, for lack of a better word. Like if the shoe was sitting on the floor and you just had it like resting on the floor, if you look at the height of the front of the shoe, like where that vamp is, there's some that are going to be a higher volume and some that are going to be a lower, more narrow volume. So we could have a shoe that the volume is too high, thereby creating this kind of ability for the foot to move around a little bit too much in the shoe. So we're getting this friction or this rubbing that is happening. And like I said, most commonly it's going to be blisters, but if this goes on for long enough, it can actually cause more kind of calluses. So the skin roughens and it gets harder in through there. In terms of physical reasons why we might see this, we do need to consider our dancers who potentially have connective tissue disorders or connective tissue issues happening. And so these would be our dancers who potentially are quite hypermobile, and within that hypermobility, maybe it is related to an underlying connective tissue disorder such as Ehlers-Danlos syndrome. In those connective tissue disorders, because our skin is made up of connective tissue, we can end up just having very fragile skin. Like the skin is just more fragile than in other people. And so even in those cases, even if the shoe is fit fairly correctly and you're not sliding around a lot, it's not that the box is too big or like too wide or things like that, we can end up with kind of blisters because of how fragile the skin is. So in those cases, we really need to work on protecting the skin. So that might be like taping each toe individually and then also making sure that we're using correct toe pads and all of that kind of thing if it is related to more of like a connective tissue kind of issue in through there. So blisters and those types of calluses are related to excessive friction. The next one that we see is also calluses or corns, and these ones are related to a sustained pressure or a constant pressure. Sometimes we'll call it like a hot spot, but it is an area where there's like something that's pressing in or creating pressure in an area we don't want it that is sustained over time. So the foot's not sliding around in the shoe, but there's something that's digging in or pressing in. And this is going to cause, like I said, kind of can cause calluses for sure, and can also cause corns as well. So they're very slightly different, but sort of similar. They are both related to sustained pressure. And in this case, as far as the shoe goes, it is often that the box is too narrow or the shoe is too low of a profile. So we need to look at creating more space in that shoe by either having a wider box or a higher profile shoe. In this type of sustained pressure kind of problem with point shoe fitting, there's not usually an anatomical reason for it in the sense that, fragile skin or things like that. It really is from sustained pressure. That being said, if we have a foot that, maybe they have a bunion or a bunionette or something that makes their foot structurally like a little bit more unique, that can be more tricky to fit because that might be where they're getting the sustained pressure. So sometimes we get into these kind of like higher level, more nuanced issues with fitting, but in general, it's going to be because the box is too narrow or the shoe is too low profile. Number 3 in the skin and nail health category is bruised toenails. And I think a lot of dancers just kind of brush off these bruised toenails, or people are just like, oh yeah, you're dancing on point, your toenails are going to go black and fall off. And it just becomes this kind of like normalized thing. But it is not normal. It is a sign that the shoe is probably not fitting properly, and we can address it. It's not something that dancers need to just kind of like quote unquote put up with. We see it in other athletes too, like running athletes especially. It's really common, but again, it's usually a shoe sort of fit issue. So in terms of the shoe, like what is causing those toenails to bruise and then usually turn black and fall off is that one thing that can be happening is that the shoe is just too short. We just need a bigger size. We need to go up a half size or up a size. The shoe itself is too short.
Or it can also be happening because the shoe is too narrow or too low profile. So that is something that exists as well. But more often than not, it's just that the shoe is too short. And where the bruising usually happens is when you are coming down from point. So when you're standing on your block, like on your box, that's usually not what's creating this toenail like bruising. It's when you come down off of your box, the toe jams into the end of the box, and that repetitive jamming into the end of the box is where the bruised toenail ends up coming from. And so this, again, is usually a pretty easy fix in that we just need to go longer in length a lot of the time. So those are sort of like the shoe causes of it. In terms of like anatomically, what could be contributing to this, we very commonly see this in people who have one toe that is significantly longer than the rest of their toes. And especially if it is our second toe that is longer than the first toe and then like the third to fifth toes. We call that a Morton's toe when the second toe is longer than the other toes, but it can be the first toe that's a lot longer too. So if you have your first toe and it's a lot longer and then the second to fifth toes are like quite a bit shorter, this can make people more kind of predisposed to these bruised toenails as well. And in this case, this is where using accessories becomes really important for the overall fit of the shoe. So in the case of having a second toe that is longer, we're probably going to need to use a toe cap or something on the first toe to sort of make it a little bit more level with the second toe so that when we are then fitting the length of the shoe, we are fitting the length of the shoe to the end of the second toe. So we always want to fit it to the end of the longest toe, but then we might need to use toe caps or something to fill in the space for the other toes that aren't quite as long. So this is also where the use of accessories and all of these types of things becomes really important to the overall fit of the shoe, because not everyone's anatomy is exactly the same. So in the case of these bruised toenails, it can be a case of having one of those toes being longer than the other, in which case we need to make sure we're fitting the shoe long enough for the longest toe. And then finally, ingrown toenails. And again, these are quite common and people are often sort of, brush these off a little bit and are just kind of like, oh yeah, I've always had ingrown toenails and I just deal with them and they hurt, but I keep going, and that kind of like mentality. But we can often do something about these. So in terms of the shoe fit, usually it is something that is squeezing the toes. So it could be that the overall shoe is too narrow or the box is too narrow, but oftentimes it can also be that maybe the box is too tapered. We might need to have slightly less taper, like a more square shaped box as opposed to a really tapered box. And that can make a big difference in terms of how much pressure is coming onto the toenails themselves. Usually with ingrown toenails, the most common place you're going to see them is on the big toe, and it's usually on the kind of outside edge, like the edge of the toenail that is farthest away from the other toes. It can happen anywhere for sure, but that is a common one because the shoe is pressing directly against that edge. In terms of physical kind of contributions or contributors to ingrown toenails, there are some people who are just genetically more predisposed to these, and it just has to do with like how their toenails grow in, the shape of their toenails. There are some things that we can try and do in terms of how we cut our toenails to try and relieve pressure off of the outside of the toenails and try and kind of encourage is maybe the right word, the toenail to grow in such a way that it is not, growing into the nail bed and is not creating issues in through there. But there are some people who are just going to struggle with this because of the shape of their toenails or just how their toenails grow. And in those cases, sometimes it is worth having the toenail kind of like surgically corrected. I don't know if that's the right word. I'm not a podiatrist. But there's a procedure that they can do. I believe it's called a wedge resection, where essentially they go in and they actually kind of like, from my understanding is, I think they kind of cauterize or kill off like the nerve roots for the part of the toenail that is problematic. And so that part doesn't grow back and the rest of the toenail continues to grow properly. I'm probably getting the details of this incorrect. A podiatrist would be a much better person to ask about the options for surgically addressing it, but it's not a huge procedure and people recover from it pretty quickly. And it can make a really big difference to people who maybe are just predisposed to these ingrown toenails. So those are all of the things I want to talk about in relation to skin and kind of nail health issues. The one thing I want to add to that is that in the dance world, I think there is this perception, especially for dancers who dance on pointe, that all of those things, whether it be blisters or ingrown toenails or black and bruised toenails and things like that, are just sort of a rite of passage and they are something that we just have to put up with and deal with. But I hope that we can change the narrative on that, because a lot of the times we can address these issues with the fit of the shoe or accessories that we're using in the shoe or things like that to address it. And these issues can be more serious than we make them out to be. I know dancers who have gotten really severe infections from blisters that, you know, they get a blister, they keep dancing on it, it gets infected, and infected blisters can actually become septic pretty easily because feet, especially for shoving them back into a used dirty pointe shoe, it's kind of a bacteria-filled environment. And so there can be much more significant long-term health consequences to some of these things. We also see other musculoskeletal injuries that develop from dancers trying to compensate for pain that they are getting from ingrown toenails or blisters or corns and calluses and things like that. So again, this can become a more serious issue than just like, oh, it's a blister, suck it up and keep dancing. We want to try and address these as much as we can because they do have more long-term consequences than I think a lot of us in the dance world have kind of traditionally wanted to recognize. So that's just the other thing I want to say about that, because they, are things we shouldn't have to put up with. And oftentimes we really can address them by either addressing some of the physical things contributing or the fit of the shoe. All right, we're going to move on to talking more about structural or biomechanical contributions to pointe shoe fitting challenges. So first one I want to touch on is what is called knuckling. And for those of you who aren't familiar, basically what happens is the toes in a pointe shoe, when you're standing on your box, your toes are meant to be long. So your toes are meant to be kind of in a straight position. And in knuckling, what happens is the toes end up kind of like curling a little bit. And often the reason we call it knuckling is the front knuckles or the knuckles of your toes start to kind of roll out or like pop out or come out of the front of the shoe. And so we see that it doesn't look like a smooth line from the ankle all the way down to the like toes, like through the whole foot. You get this kind of weird sort of break in the line where the knuckles are in through there. So as far as shoe contributions, often this is happening because the box is too narrow. And so the toes don't have enough room to actually be able to do their thing that they're meant to be doing. And so you'll get this kind of knuckling or buckling that happens. Or we often see it if the vamp is too short. And so again, if you have longer toes or just, require a longer vamp, then sometimes we'll see this knuckling happen where the toes are sort of not being supported enough and coming out kind of the front of the shoe. As far as physical reasons why we see this happen, we often see this happen in dancers who are weak in their intrinsic muscles in their feet. So those are the really small local muscles in the feet that help to stabilize our feet and help with shock absorption and those types of things. A lot of dancers are not super strong in those intrinsic muscles, and that will often cause this knuckling to happen. And then sometimes we will see this, and this is maybe a little bit more in older dancers or people that have been doing pointe work for a really long time. So we see it maybe more in a professional dancer than in a younger dancer who's starting out in pointe work. But if people have kind of contractures that are happening in their toes, so hammer toes, for instance, or things like that, where they have like an actual deformity in their toes, then sometimes this knuckling can happen as a result of that. And hammer toes would be the most common one that we would see. All right, next one that we see, and this is actually probably the most common issue that I see or dancers come in talking about struggling with shoes, and this is twisting shanks or feeling like the shoe is twisting on their foot. So again, from a shoe perspective, this could be because the shoe is too narrow. And often it's not just the box, it's the whole shoe is too narrow, but it could be the box as well. But the shoe is too narrow. This could be happening because the box is too tapered. Again, we talked about this with the ingrown toenail thing, but if the box is a little bit too tapered, they might need a little bit more of a square box to prevent some of this twisting from happening. And this also happens really, really commonly if people have too much padding in their shoe. And this is a big one because especially dancers who are maybe newer to pointe or less experienced, or, you know, they've got toe spacers and toe caps and they're taping and they're putting on toe pads and they're putting all of this stuff in their shoe. But that actually sometimes creates more issues than it solves because it can cause the shoe to sort of twist if there's too much stuff kind of moving around and just too much stuff in the shoe. In terms of issues that are more physical that we see, this commonly happens due to a muscle imbalance around the foot and ankle, and sometimes this will be post-injury. We'll see people who have had a previous injury, maybe an ankle sprain or something, and so maybe muscles on one side of the ankle might be a lot stronger and on the other side might not be as strong, and so that can cause this twisting to happen in the shoe. It doesn't have to be from an injury, though. We commonly see muscle imbalances develop for other reasons, and it might be for technique reasons, it could be from growth, it could be from all sorts of things, but a muscle imbalance around the foot and ankle can certainly cause twisting in the shoe. And so this can be, you know, a dancer who's trying on a million different pairs of pointe shoes and every single shoe they're trying on feels like it's twisting on their foot. If you've tried on, you know, half a dozen different shoes and all of them are having the same problem, it's very likely it might actually be a physical issue and not a shoe issue. So probably something to go and get investigated. We will see twisting shanks happen if there's instability in the ankle joint. So again, most common time we see this is if a dancer has had an ankle sprain, so post-injury. But we can also see ankle instability show up in dancers who are just really hypermobile and maybe don't have the strength built up yet to control that. Again, this is one of the reasons why doing a pre-pointe assessment and making sure that people are actually ready to begin pointe is really, really critical. And then I often see twisting shanks happening if there is an issue in the mechanics at the subtalar joint in the foot. So the subtalar joint is the joint that controls kind of inversion and eversion, or in dance terms, like rolling in or sickling the foot. So the side to side movements of the foot and ankle. And sometimes we'll see a problem with the mechanics of that joint where it's just not gliding properly or it gets a bit stuck or a bit jammed. And so it might cause the heel to not move properly when we're going up on a releve or those types of positions. And so sometimes that can cause the twisting in the shank as well. So again, if you've tried on a million different pairs of shoes and they all are having the same problem, I would highly recommend looking at your actual anatomy and seeing if maybe there is a structural issue happening in the foot itself that is not related to the shoe. All right, number 3, sinking in the shoe. And so this is happening generally when the box is too wide. And so as a dancer goes up onto their box or like goes up onto pointe, the foot kind of sinks down into the shoe. This can cause the toes to kind of crunch or to curl. And I think sometimes people, if they're feeling that crunching or curling in their toes, they think the shoe's too small, like it's too, it's too, too short, too small. But oftentimes it's actually that the box is too wide, and so their foot is sinking down into the shoe. It's not hugging the foot and keeping the foot stable. The foot is able to slide and sink down into the shoe. So we need to really look at the width of especially the box in that situation. From a foot perspective, this often happens if we just have some weakness that is happening. And again, this could be true muscle weakness where there can be muscles that are just not supporting us. So maybe often it will be like core and trunk muscles. It can be leg muscles. It could be ankle muscles. It could be anything. So we might have a weakness, a physical weakness that is creating this. But what we very commonly see, and this especially in very beginner pointe dancers, or if it's like their first time being fitted for pointe shoes, is a lot of dancers don't necessarily understand off the bat how much muscular activity and control is required to stand on your box, to stand on pointe. And so they're just really relying on the shoe. They'll step up onto pointe and they kind of let all of those muscles sort of like relax, for lack of a better word. And oftentimes it's the ankle muscles. It might be the muscles around their knee. And so they're just kind of sinking into the shoe because they're not actively engaging the muscles to support the structure of the foot and of the ankle. So sometimes it's actual true weakness. They're truly not strong enough to support it. But more often than not, what I would say is it's maybe like incorrect muscle recruitment that is appearing to be a weakness, but it's just that they don't necessarily know which muscles they are meant to be turning on and to be kind of activating in order to achieve the stability and the strength required to dance on pointe. The other reason we see sinking in shoes, and this is probably one of the hardest ones to solve, is what we call a compressible foot. And anybody who is a pointe shoe fitter out there knows what a compressible foot is because it's probably been the bane of your existence. But essentially what a compressible foot is it's a foot that's very, very mobile and it changes shape really easily. It is sometimes associated with generalized joint hypermobility, so in our hypermobile dancers, but not always. We can have dancers who have compressible feet who maybe are not hypermobile in other parts of their body. But this foot is a really hard one because kind of no matter what we do to it, it just kind of like squishes and molds to whatever position we put it in. That's kind of a weird way of putting it, but it's just very compressible. And so when you're first fitting the shoe or if the dancer's standing on flat, it's like, oh, okay, this looks like a great fit. And then they go up on the box and their foot is just able to compress so much that they end up sinking in the shoe. And this, like I said, is a really hard one to deal with or to fit because we don't want to go too narrow or, create too much compression because when they're not on pointe, their foot will actually sort of splay and widen. And so we need to make sure that they have enough space in that sense. These feet, in terms of working with dancers who have a really compressible foot, definitely being fit in the right shoe is really, 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 really important, even though it's really tricky. But also, they need to be so strong in all of the musculature around the foot and ankle. So especially those foot intrinsic muscles, but also the ankle muscles and stuff. And they're going to probably have to rely more on their muscular activation and muscular support so that they are not sinking in that shoe. All right, last one. We have dancers who struggle to get over their box. So either an inability or just a struggle to feel like they can get over their box. From a shoe perspective, number one, the shank is probably too stiff. So a lot of dancers really want to go for a super, super strong shank because they think, okay, this is going to make the shoe last longer. I'm not going to break it in as quickly. And especially parents, when they're forking out really a lot of money for pointe shoes, they're like, okay, how do we make this last as long as possible? So there's a temptation for people to go for a stronger shank. But a lot of people, the trade-off of that is that you might then struggle to get over your box. So going for a stronger shank is not the solution to prolonging the life of a shoe if you're not strong enough for that stiffer shank. So stiff shank, Very, very common reason. The other thing that we sometimes see is that the vamp on the shoe is too long. And so again, if you say have shorter toes or kind of a shorter forefoot and the vamp on the shoe is really, really long, you're going to struggle to be able to get your weight forward enough and to get right on top of that box. So we want to make sure that we're looking at the vamp length as well as the kind of stiffness of the shank. In terms of weakness, or in terms of foot issues, number one we see could be weakness. And when people are struggling to get over their box, more often than not, this is weakness in the calf muscles, not necessarily the intrinsic muscles in the foot as much. This can be weakness in either the gastrocs, like the bigger calf muscles, but really commonly I'll see weakness in the deeper calf muscles. So either the soleus muscle or even some of the extrinsic foot muscles that are the little muscles that start in the calf and then go into the foot. So we potentially have weakness in those muscles that is making it hard for that dancer to get up on over their box. Again, this is why we want to make sure that we have done a proper pre-point assessment to ideally identify those weaknesses before a dancer starts point so that when they do start point, they're not struggling with this type of thing. We can have dancers who have just an ankle mobility limitation. And so one of the pre-point assessment tasks that we look at, or the test that we do, is what's called the pencil test. And that is where the dancer sits on the floor or wherever and points their foot. And if you laid a pencil across the top of the ankle joint, we want that pencil to be able to sit flush with the ankle joint. So essentially we want 180 degrees of ankle plantar flexion. And there are some people who anatomically just do not have that amount of mobility. And that is meant to be one of the criteria to decide if somebody is ready to do point work or is kind of like structurally going to be able to do point work. And people who have really significant limitations in their ankle are probably never going to be super well suited for point work. But we often get dancers who are maybe lacking a few degrees of that mobility and they really, really, really want to try point. And so sometimes, as long as they meet all of the rest of the prerequisite strength and control and all of those things, we will sometimes say, okay, you can try it, but one of the things that those dancers will often struggle with is their ability to get over their box because they just anatomically may not have enough mobility to be able to do that. And then one of the other things that we sometimes see is an actual what we would call an impingement. But basically, so this is a structural issue as well, but this is potentially a modifiable structural issue, if that makes sense. So we have the people who just, the shape of their ankle joints just means that they don't have that 180 degrees of ankle plantar flexion. We also then have this other subgroup of people who when they point their foot down, it just kind of feels like it gets stuck, and it's usually in the back of the ankle, and it's some sort of like a pinchy feeling or a pain or something deep in the back of the ankle. And this is generally what we call a posterior impingement. And there's two different types of posterior impingement. We can have a soft tissue impingement, and I'm not going to talk about that right now. And in fact, there is a podcast episode on posterior ankle impingement. So if you're interested in knowing more about the difference between the two types, episode 24 is all about posterior ankle impingement, and I'll link that in the show notes. But in some people, we get what is called a bony impingement, or it's most commonly referred to as an ostrigonum. And it's a little extra piece of bone in the back of our ankle joint that most people, it fuses to the back of the ankle, but in some people, it either doesn't fuse properly or it's just extra large and extra prominent. And that can limit their ankle mobility when they try to go up onto their box or point their foot. This is addressable, I will say, in the sense that they will sometimes surgically remove that little extra piece of bone, and especially if it's only interfering on one side. And we see this commonly where somebody will have no issue getting up over their box on one side. One side feels totally fine. They have great mobility, like everything is fine. And the other side, they have this limitation and they're getting this pinching and this pain. in those instances, those people generally do respond well to having that piece of bone surgically removed because the structure of their ankle joint is such that if they didn't have that little limitation happening, they actually would have adequate mobility to be able to do point work easily. So it is something, again, we don't commonly see this, and it's usually something that if somebody's not really serious about ballet and wanting to pursue kind of like professional careers in ballet and things like that, most people aren't going to opt for a surgical intervention. But if we have dancers who are very serious about ballet and specifically, professional levels of ballet where point work is going to be required, it is something that might be considered. In other dancers, sometimes they'll just say, do you know what, I really love dance and I love other styles and I'm going to focus more on contemporary or jazz or something that doesn't require just quite that extreme range of plantar flexion, and they'll be completely fine. They often don't need to have it kind of surgically addressed, but just something to keep in the back of your mind, especially if it's only one foot that is struggling to get up on your box. If you are having issues on both sides, then we're more likely to look at, okay, is it the shoe that's a problem or is it just generalized weakness or, other limitations? But if it's just one foot, then we might want to keep in the back of our mind that maybe there could potentially be a bit of an impingement or an ostrigonum happening in that particular ankle. All right. Those are all the things I'm going to talk about today. I know I didn't cover every single challenge in point shoe fitting, but these are the ones that we most commonly see. As you can see, there's lots of different things that can be causing these in terms of either the shoe and or the body. Big take-home messages, I would say, are it's really, 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 really important to go and get professional point shoe fittings. Like I said, I am not an expert in point shoes. I can tell you that this issue is probably caused by the fact that, I don't know, for example, the box is too tapered, but I am not going to be able to say, go try this, and this model instead, because I just don't have an up-to-date enough knowledge about what is available. So I'm going to be able to say, you need a less tapered box based on what's happening physically. And then the point shoe fitter is going to be okay, these are going to be the options for your foot profile and that come in a less tapered box. So having a professional fitting is really, really important. I cannot stress enough that we really cannot be purchasing point shoes off of the internet and things like that, unless again, you're a very experienced point dancer and you're just buying the exact same pair of shoes that you've had previously. Even then, point shoes are handmade most of the time, so they're not all going to be exactly the same. So whenever possible, if you can, try them on in store and get them fit in store. That is going to be preferable. I know that is not always possible depending on where in the world you live and whether there are point shops near you and those types of things. But we really, as much as possible, do want to have a professional point shoe fitting done. And then we want to really collaborate between healthcare teams and point shoe fitters. And teachers are generally part of this conversation as well. I haven't talked about the teachers, but they're going to be the ones who are observing in class what is happening and what a dancer is struggling with when it comes to dancing on point. So obviously they're an important part of the team as well, but we want to have these collaborative efforts because, again, if you're trying dozens of pairs of shoes and finding that every shoe is causing the same issue, either you're getting a pressure point or the shank is twisting or you're sinking in the shoe or whatever it is, we then need to start to look at what is happening physically in the body and try and address that as well. Because if we're having the same issue with shoe after shoe after shoe after shoe, it may not be a shoe issue. So that is what I'm going to say on that. Like I said, I am absolutely not a point shoe fitting expert, but I do think that our expertise in terms of the mechanics of the foot and how the body works and the mechanics of point goes so nicely with point shoe fitters expert in terms of knowing what products are available on the market. So I hope you found that helpful. If anyone has any questions, please feel free to reach out to me. I'm always happy to answer them to the best of my ability. Thank you so much for listening, and I hope you have a great rest of your day.